strong and mighty.
That's right.
Yes, we're in Kunimo.
Palm Sunday.
See, I'm an overcomer.
Ushering in the Holy Week.
Listen, no weapon fashioned against me shall prosper. For the greater one lives in me, yes, it does. Yes.
Hope you got your palm fronds and you're waving them. Still time for Ultimate Health on Joy 99.7 FM. Somebody just sent me a message, I was angry in traffic. He said, but declare your interest in these dentists.
Joy 99.7 FM.
But honestly, I'm not happy with whoever commissioned the interchange and will just not finish the approach. I've been in hellish traffic at the Mortuary Road approach to the overhead interchange, whatever you call it. It is not done.
Joy 99.7.
Frankly, I'm just approaching a radio station for a radio show. But what if you were transporting a patient to Kolebu? I pray nothing has happened to somebody because of that mess.
Joy 99.7 FM.
But don't let me get started on those things because we won't finish. Last week we were looking at common child and adolescent dental issues. We managed to actually erupt some teeth. We learned about children who can be born with teeth, natal teeth. I've got Dr. Daniel Brefo in the studio. Pedodontic specialist, Hey. And then next to him, Madame Dr. Manye Novishi Hakutu, specialist orthodontist and lead clinician at the Platinum Orthodontics and Advanced Dentistry. We're going to go back into some of those things, and some of you were pleading with me to bring them back. But like I learned and insisted last week, this week I would brush, rinse, and spit out the dentists. My dentist, you're welcome.
Hi, good to be back.
Right.
Thank you.
Yeah, right, Dr. Brefo. I'm going to rinse and spit out dentistry for a while. I know May is, there's a World Oral something day coming up.
It's World Orthodontic Day, which is 15th of May.
Oh, okay. We'll give it a thought. All right. But you're welcome and welcome back.
Thank you.
Yeah. My listeners, I don't know why they can't finish chewing all the stuff we've given now. But yes, there was a justification for the emphasis on child and adolescent presentations. We learned that, hey, from 1 year old, you want to be seeing these kids. You want them to be getting accustomed to the whole oral health stuff, right? Their parents also need to get into the driving seat. And I think last week we managed to do most of the early stuff. We did the caries or cavities. We did looking at the development and eruption of teeth and many other things. Dr. Akutu, is there anything on that side? Because I really want us to get into the teeth proper and then the issues of alignment and other presentations.
No, not really, except to say that I don't think that we were considerate enough to the caregivers of these children. I think that brushing children's teeth requires a lot of patience. And the only thing that we would say is, well done, keep doing it. And if there is just one tip that I would give on reflection, what I always say is that actually try and approach the child from the back. So brush the teeth with the child lying on you and from the back rather than the front, because all they do is just move away from you. So that's my one tip on brushing for the smaller years.
Hang on. From the back.
Yes.
Child on the parent.
So rather than actually brushing from...
Hang on. You've got your Godzilla here with the teeth, right? Those of you online can see she's holding some creature. Obviously, it's not a Ghanaian creature. Right, so demonstrate.
So what we're saying is that lots of people try and brush with them facing the child.
Okay.
And all that happens is that the child keeps moving away from you.
Okay.
So it's significantly easier, and there's a reason why dentists approach patients from the back.
Okay.
To actually have the child facing the same direction as you are facing.
Standing, sitting, what
sitting or even lying back is even more preferable.
All right.
So then you have ultimate support, and as they move their heads around, you can actually move with them.
Okay.
And then things those are significantly more controlled.
Okay, now if you were here with me, this looks like in UFC. This is called a rear naked choke, right?
Yeah.
Right? Yeah. And then Charlie, it's a hold that at least gives the parent control.
Yes.
Right? And then they can brush appropriately.
And it also gives you a lot of visibility.
Okay.
So you're able to see things, you're able to control more. And the other thing is to use music. So we all know the love for music.
Music.
Yes, but singing a song, whether it's brush your teeth, it tells the child how long the actual process is going to take.
Okay.
So I find that that's another really useful tip for the younger years.
All right, Ghanaian parents, please. My WhatsApp is 055 11 997. This is a mouthful. Approach the child from behind. Use that hold to control what the child is able to do. You get to look and see and control the process. And Dr. Akutu suggests that Chale Tonyum Kakra, add music, which kind of gives some like borderline time wise for the whole process. When the song is finished, we are finished. Huh? She hasn't met some children. Dr. Brevo, well, okay. Now I understand why they call you Brevo. Because of these holds. But, okay. So we got past that. We explained children who might come with teeth and the fact that these teeth might not stick around for too long. They may be wobbly and they need to be seen because if not, they might detach. They might swallow them and all that. Okay. Right. We talked about the type or the amount of toothpaste, right? And that parents should be aware of these things. She said a grain of rice. If you're doing very, very little children, infants, brushing their teeth, don't squeeze the thing as if they're having a meal. Okay? We don't want to encourage the children to swallow, but then we wanted the fluoride to stick around for some time. Dr. Brevo.
Yes. So as we said last week, for the babies, they usually won't spit out. They don't have the ability to rinse out.
Okay.
So I mean, the amount of fluoride in the toothpaste actually is age recommended.
Okay.
And if you use the recommended toothpaste, I mean, what goes into your system is okay, and we just want the toothpaste to stay around.
Okay.
And also, I'd want to add that I mean, at a certain age, we want to be weaning them off bottles.
Right.
Last week we couldn't really touch on that. So as we're weaning them off bottles around the age of, let's say, a year to 18 months,
Okay.
that's the time that we recommend.
Okay.
And as we're weaning them off, we do sippy cups. Sometimes you give them porridges on spoons. You don't want to be using spoons that the adults are using at home.
Okay.
Because already we have microbes in our mouth, and then the kids are now going to establish their own microbes. So
you want
if
the
you
children to have their own spoons,
own spoons,
child-sized spoons.
very, very good. That's it.
All right.
Yes, and also you don't want to be blowing on hot food and giving it to them because there's some amount of saliva that's going to go onto the food and then go into their mouth.
Hey.
And people kissing their babies on the lips and sharing saliva, it's not right because it's going to be the microbes are going to establish on the teeth and they're going to have more microbes in the mouth, or let's say germs in quotes in the mouth.
Give mommy mwah. I mean, come on.
Cheeks are fine.
Cheeks
Are fine.
Oh, but nobody is going into this serious professional, But,
I understand,
so
but mwah,
it's not a good thing. On
So
the
with
lips.
babies, as Dr. Kutu said last week, when they are teething, they drool a lot, they're bringing saliva, and then you probably might have, you think you're just going to do mwah with that and then just sticking on the lip, but then you're introducing germs, and then they'll be taking it back.
All right, I'm starting to regret bringing them back, but well, if they are the professionals. So if you have any questions, concerns, WhatsApp is 055 11 11 997. Platinum Orthodontics and Advanced Dentistry. They themselves are a mouthful, but they've been helping us for the past couple of weeks. I'm going to give them a break. So this is your last chance to zoom in. 030-221-6541. 055 11 11 997 is my WhatsApp. Okay, right. So we've got the kids. We know how to hold them, how to tackle them. And so at what stage, we talked about that last week. When do we want them to start brushing for themselves?
So that's a really interesting question. You start I can do it myself around 2.5, 3 years of age, and we want to encourage that, but they are literally playing with the toothbrush. They're chewing on it. They're spending longer with fluoride in their mouth, so we like that. But once the play stage is done, the caregiver still needs to do the actual brushing.
Okay.
So that becomes a two parts. And that transition really takes place until around the age of 6, where they start brushing independently.
Okay.
However, we are very, very clear that until the age of 9, or until the child has shown that they are able to clean effectively, it still remains the caregiver's responsibility.
To supervise.
Yes.
Right. Okay. So those of you living when the child's school is somewhere, you wake up because water starts coming around 4 or 5 a.m. Then you've got all these things to do. Right? The dentists are saying supervise, make sure that your child is brushing their teeth properly with your supervision, and gradually they will transition into independent brushing. Note that one of the things my guests emphasize is that a lot of the stuff they want to do in dental health care is in a preventive mode. They want to stop things from going wrong, prevent things from going wrong. So we've got to get these patterns, these habits, should I say, integrated, internalized properly.
Yes, I think it's really, really key, and we also need to be highly realistic. So, in the scenario that Nortey has actually set out, if we had a preference, we would obviously say supervised brushing twice a day, but the one that is really, really important is the nighttime brush.
All right.
So the supervised brushing at night, we don't want to play with. That one is the one that takes priority.
Okay.
That's number one. And then number two, just when you're doing the transitioning, it's a really good idea to use something called disclosing tablets. And what those are is that they are just a food dye, but they are really effective at demonstrating where the cleaning is not being done. So in effect,
Disclosing tablets.
yes.
So wait. Disclose for my listeners. Right?
So-
Wait. Disclose for my listeners. Now, you said it's a kind of a food dye.
Yes.
So I'm thinking this is something you dissolve in some water or what?
So you brush your teeth first,
Okay.
and then you chew on one of these pills. They're just like a pill.
Okay.
And you use your tongue like a paintbrush to paint all over your teeth. And then you take a look in the mirror. And if you've left food in your mouth that has been there for up to 3 days, it will show up pink. And where there's been food that's been there for greater than 5 days, it will show up purple.
Whoa. Listen.
Joy 99.7
Hey,
FM.
child. All right. So this is the tail of the tape. If you've got stale debris, food particles in your mouth, this dye will disclose.
Exactly.
This is Lapore dye. It will tell the Toli.
It will tell the Tony.
So it will show you where you are really not brushing properly.
Exactly. And if you go back and you concentrate on those now colored area, it will brush off. So this is a really amazing tool to
This is
help
not
in the
a daily
transition.
disclosure, is it?
Ooh, I think that daily is a bit much. And so most of the time we'd recommend that this is done twice a week. And again, we really like at night.
All right, adults, we're doing child and adolescent dental issues, but this disclosure is for all of you. Before doing all the kissing and stuff you've been doing, please, there's a litmus test now, right? Can adults can use this as well?
Yes.
Yeah,
Yep.
disclosure. So you go into the pharmacy, or where do you get this?
Some pharmacies, we definitely stock them at the practice. But yes, they're just known as disclosing tablets.
Right. Hey.
Joy
Yeah, Samuel.
99.7 FM.
Right. Please, I'll do my disclosure to myself. All right. Okay, Dr. Brefo. So, kids, this sounds like, skilled labor. This whole business of cleaning our teeth and keeping, should I say, up to par with dental health is not a joke. It's skilled labor.
So the focus is on prevention, as we've stated already.
All right.
And it's more expensive to do other stuff, like let's just say come for the treatments than to prevent.
Okay.
So in as much as you do it every day, you become good at it, and then you know what you're doing. So
Okay.
that's where.
All right,
we
great
can-
stuff. Let me see what disclosures are on my WhatsApp. My 2 kids suck their fingers. Hey. And the older one who is 4 years, seems to have her teeth forward. If the finger sucking persists, will the habit affect the growth of the adult teeth? Benjamin, was this from last week? Or this? Okay, he sent it again. Right.
Okay,
Yeah.
go on.
So habits, there are so many habits. There are what we refer to as digit sucking, because it can be thumb, fingers, etc.
Right.
Then there's tongue sucking and lip sucking. From a dental point of view, we actually prefer digit sucking because that's usually easier to deal with. To answer Benjamin's question, it is considered
99.7
normal
FM.
until around the age of 4 or 5. So we have to understand that non-nutritive suckling is something that kids get a lot of psychological well-being from. So up until the age of 4 or 5, you can encourage them, but we are not so gung-ho about getting them to stop. However, you are perfectly right. It will affect the position and the formation of the baby teeth, and we need them to stop before the adult teeth start coming through.
Okay.
So at the age between 4 and 6 is when we really, really concentrate on breaking the habit.
All right.
And the way that we break the habit is, first of all, moms, dads, you can try whatever you want to do, but you usually have about a 50% success rate. What we know is that as trained professionals, we are taught in how to talk to the child, how to inject some autonomy. The autonomy part is really, really
So the
important.
child is the boss?
We make them the boss in this actual situation
All right.
by doing things like getting them to pick the day and the date that they are going to stop. And then we also add adjuncts, whether it's the bitter things on the nail or whether it is a cover that you put on. We all know that once the child has bought into the idea, during the day they are able to control it. It's always at night that it becomes a struggle.
Okay.
So we will add implements such as a thumb cover or a digit cover, which will help them along the way.
Okay. Dr. Breffo, I mean, the day in Maryland said, not kissing the lips of their kids. Don't say that to folks whose dogs lick. Oh, this is why your president, Dede in Maryland, says they're eating the pets. pets licking your lips and all that. I will add veterinary doctors to my guest, and then we can discuss that. But she's saying that it's a bit on the much side. But once we are aware, once we are informed, we should be transformed. Okay, there are things we're doing that we think are harmless, but once we've been informed and equipped with good information, why we should I say, limit these things? I think it makes sense. Yeah, Dr. Breffo.
Definitely.
Okay, right.
Definitely.
But babies do love a little smooching and. Okay.
Yeah, so as I say, you can actually do that, but I mean, limit it, and then preferably on the forehead, on the cheek,
All right.
it's fine, but always on the mouth.
Okay.
I mean,
I like the bit about autonomy. I handled a kid, I think he was a bit older, about 9 or 10, with a thumb sucking problem. And his mom came with him all anxious and all that. But I found out from the boy that, oi, do you do it in school? No. Okay, why not? They'll laugh at me, they'll tease me. Okay. At home, when daddy's not there. Right. So I said, hey, Sonny, you have the control, just that I need you to use it a bit more often. Right? It looks like when you want to stop, you stop.
Exactly. And so I think that that's why dental professionals have a much higher success rate, even if we just talk to them.
Okay.
Because we're able to pull
Now you're
out
putting
some
me out
of
of
these
business.
things. We're able to pull out some of these things, and then we can also effectively demonstrate what will happen if they don't stop.
Okay. Good afternoon. I understand, Frank. Oops. Is this for me? What is the cause of tooth decay in children? I have a small girl, 3 years, whose front teeth are always cracking, and you can't really see the teeth in full at all. And it's also discolored. Good afternoon. I'm Abla from Pokwasi. Doc.
okay, so I think last week we mentioned this. We said that when we feed the kids and then we don't brush, especially the nighttime feeding, as Dr. Akoto is saying.
Okay.
So people, remember last week we were saying that some parents will pick up their children. Once the teeth are coming in, they feed them, they bottle feed them, and then they sleep off. And then they don't wipe the teeth.
Okay.
What happens is all these sugars, all these foods stay around the teeth.
Okay.
And as I was saying, we all have these microbes on our teeth. And then they start attacking the teeth and then causing all these cavitations.
Right.
But then the interesting thing is, because when we are sucking, the tongue actually lies on the lower teeth, bottom teeth. It hardly affects these front bottom teeth. It's generally mostly the upper front teeth and then the back teeth where these foods stay and then start causing all these things.
Okay.
So I think he needs to see a dentist. He or she needs to see a dentist,
Right.
and then get it sorted.
All right. And last week we learned that the baby teeth are more vulnerable and more delicate, right? So they're more likely to chip and crack and all that. And you mentioned the childhood traumas, the little accidents and things in school and all that as well.
Yes, so I think just to go back to what's going on at night, you need to be ridiculously careful. Basically, during the day, you have a lot of saliva. Saliva is amazing. It's like a water hose. So whatever it's in your mouth, the saliva is going to come and whoosh it away. At night, the tap gets turned off.
Okay.
There's no saliva coming through.
You're not
So
producing that much saliva.
you are
when
not
sleep.
producing
Very
that
little.
much.
Okay.
So everything is now going to stay in. So it may be with this child something as you know, that has not been realized, that they may be taking a medication that has sugar in it. Even Calpol, that everybody loves, paracetamol, has sugar in it. So if you brush at night and then you give them the Calpol after you've brushed, the mouth is now filled with sugar, and then they're going to go to sleep.
Okay.
And as they sleep and there's no saliva, the sugar is now going to start eating away at the teeth. So you need to be really, really careful that the last thing that goes into the mouth is either toothpaste or water.
Okay.
And last, we mean last.
Okay, I'm starting to feel sorry for these kids. In fact, I'm feeling sorry for myself in retrospect. When I was a child, I'm here. This is President of Hacho Discerning Listeners Association, Rookie. All right, good afternoon, Nortey. I'm writing to seek your expertise regarding my 10-year-old son's dental development. After losing his milk teeth, I have noticed that his adult teeth are taking longer than expected to fully develop. Could you please offer some insight into possible causes and advice on what to do next? Rookie inside Hacho. My expert advice is to bring in the experts and then let them speak. Docs.
So developmentally, I think that we are all in such a rush. We need to remember that the last adult tooth, other than the wisdom teeth,
Okay.
are meant to come through as late as 14, 15.
All right.
But somewhere along the line, we've all decided that all of the teeth should be through by the age of 9.5, 10.
Okay.
No, according to the books, it can take, the adult canine teeth only come through at the age of 12.
Okay.
What we do find in the Ghanaian population is that we tend to erupt our teeth at least 12 to 15 months ahead of the books. So we are now seeing 10-year-olds that have all of their adult teeth, but we don't usually expect you to have all your adult teeth until you're around 14, 15.
Okay.
So
So where are we in a hurry to?
yeah.
What's happening with us? Is there an explanation for this?
I am not aware. I assume there's something genetic going on.
Okay.
But what we would always say is that obviously try and see a dentist.
Okay.
An X-ray will make sure, because the other thing that we need to be aware of is that there are people who do not develop the right amount of adult teeth. So an X-ray is just going to tell us whether they have the right number of teeth
Okay.
and whether they are on track, not only in terms of their development, but also in terms of how they look and the quality and the formation of the teeth.
Okay, you've mentioned imaging here, X-ray.
Yes.
Now, one of my WhatsApp messages said that the teeth are not visible. Is it that they've sunk into the gum, or what he was saying, that you can't properly see the teeth?
Exactly. So X-rays is obviously going to show us the teeth that are actually in the bone as well.
Okay.
And so just one X-ray that goes all of the way around will capture the whole jaw and will tell us exactly the number of teeth, their actual degree of formation, whether they're forming naturally, etc. So all of those questions will be answered by one prescribed X-ray.
All right. So are you suggesting to Rookie in Hacho, president of our Discerning Listeners Association, that at 10 she should relax?
We are suggesting that actually by between the age, they should be going to a dentist anyway.
Okay.
Secondly, if we are concerned about developing teeth, you need to go and see a dentist who's then going to prescribe the x-ray and then interpret the x-ray. But from a dental development point of view, we should be doing another type of screening around the age of 8.
Okay.
Which exactly is looking at the formation, the number of teeth, the alignment of the teeth, and the position of the teeth within the jaws.
Okay. Right, 39 minutes past the hour of 2. We started late, but hey, we are moving, right? If you have any questions, concerns, WhatsApp is 055 1111 997, phone line 030-221-6541, so that you can bully the dental terrorists in my studio alongside me. I'm sure when I asked the question about, gums and teeth that are not showing and all that, I was praying that they wouldn't say there's some disclosure gum that you chew and then it will show all your problems. But hey, they are the professionals. So there's an easier way of finding out, checking, and maybe diagnosing conclusively. If there's a problem, then why not? Why not? Okay? And why not call me 030-221-6541. WhatsApp is 055 1111 997. We're still in the mouths of our children and adolescents. Okay. So we're growing. By 12, 14, we should have our full set of adult teeth. All right? Or?
Not a full set.
Not full set.
Not quite the full set, but since we are now doing the teenage years, this group is a very, very interesting group because, yes, we are looking...
Hang on. Should I not have gotten to the teenagers?
No.
Have I jumped?
No.
Okay.
But we just need to be very, very careful as they are now in the position to make more diet choices.
Mm-hmm.
And one of the major things in that
like
teenage...
those who say, Mommy, I want chicken in the box.
Chicken in the box,
KFC.
for us is fine. But what we find is that mummies and daddies could have done a wonderful job until about 11 and a half.
Mm-hmm.
And then all of a sudden, whether it's school money being given, the diet goes haywire. And the usual cause of the diet going haywire is fizzy drinks and what they are consuming in terms of drinks. So with this age group in particular, once you've done all of your hard work and you're handing over, just be extremely careful about the snacking. Mm-hmm. And one of the ways of really limiting sugar is to look at the drink habits of that particular age group.
Okay.
But you are perfectly right that when we are entering that teenage years, pre-teens, is when we really start looking at the alignment and the position of the teeth.
Okay.
And we are looking at how they are coming through, where they are coming through, and also whether there's something that we can be doing to improve the way that things function, firstly, and then secondly, the way that things look.
Okay. Structural issues, functional issues. Your teeth are not just there for the fun or the beauty of it, right? They've got work to do, right? If they're not developing properly, appropriately, optimally, then that work might not be happening, right? That's why I've got my guests in the studio. Dede is asking, is it advisable to give kids chewing gum? Hello, Nortey, please. My son is... Let me click on that. Okie dokie. My son is 6 years, 7 months now, but has still not shed his milk teeth yet. Should I be concerned? Yeah.
No, not really.
I like the way you look at each other before you answer. Yeah.
No, not really. But we normally say that we start shedding teeth around from the ages of 5.5 years through to about 7 years. That's when our first baby incisors start coming through. Okay. So he's still within the time, but then he can still come and see us.
Right.
The other thing is we also get our first adult molars around this age.
Okay.
So maybe you can also check to see if there are new teeth coming up at the back of the last baby teeth. But then he will do well to consult a dentist.
Parents have to resign from work and be stuck in their kids' mouths because all this stuff. Okay, so teeth are coming out. They're supposed to be replaced and all that. If I have any concerns, I should go with my child to a dentist.
If you form the habit of seeing us twice a year, every 6 months, then we will. That's why we are here. The dentists are here to check on the developmental stage, to encourage the actual habits, to to like make sure that we are going overboard in terms of prevention.
Okay.
Yeah. And so rather than you worrying, let us be part of that team with you. Bring them twice a year. We will tell you everything. Any dentist will tell you everything that you actually need to know. And then we will be tracking the actual process as well.
Right. Okay. I thought my job was a lot of talking, but these dentists can talk. Eh? Hey. All right. 030-221-6541, 055-1111-997, the phone line and the WhatsApp. This is Ultimate Health on Joy 99.7 FM. Every Sunday, 2:05, we come alive and we bring all the practitioners, professionals into the studio after church. If you didn't go to church, as for health, it is important. That is why we have brought the dentists from Platinum to talk to us. And we're looking at dental issues of kids. Okay, we've done cavities or caries, as they would have it, and other stuff. Okay, we did a bit of the bad breath for kids as well, and some of the causes of that. We looked at the formation of teeth, alignment. You know, digital sucking, thumb sucking, all these things, accidents, falls, and all that. Things get cracked, crooked, and misaligned. Now, let me start with this one. Somebody asked me, so a child who has a lisp, you know, the lisp and all that, is that a dental issue?
Okay, so that's a really, really good question. The formation of the teeth could be a significant contributing factor.
Okay.
So imagine if the child has been sucking their thumb,
Okay.
and now there's a vertical gap
Okay.
between their teeth. Now their tongue is not able to get to where it needs to make specific sounds, such as the, th.
Yeah.
And so they start to struggle and lisp.
Okay.
However, we really work in conjunction with the speech and language therapists for this. Because speech and language exercises that can produce amazing results in 6 weeks can retrain the tongue as to where it should be positioned.
Okay.
So they do their bit, and then we reposition the teeth so that the habit does not reoccur.
Okie dokie.
Joy 99.7
Those of you
FM.
praying for children, and we'll be back on board with our, Conception 2025. Please, there's work to do, right? Aligning tongues, teeth, and all that. Gap between upper teeth, lower teeth. It's a mouthful. But let's come back to alignment. You explained to us in one of our earlier shows that the upper teeth should lead the lower teeth by some average gap.
Yes.
Right. So for these children where things are still forming, are we expecting this to be in conformity with certain norms? And at what point would we say there's misalignment?
So we have norms depending on the number of teeth, adult teeth, that are actually in the mouth. But what we are finding more and more is that there are deviations that are coming. So rather the upper teeth are too far forward, or the bottom jaw is too far back, or some of the teeth are stuck in the bone and do not come through, or a baby tooth was taken out early, and now there's not enough space for the adult teeth to come through. So we are getting a lot of these things. It's very, very interesting. Some of our clients ask us, when we were growing up, there weren't that many people having braces. Now every child seems to have a brace. What's actually going on? A lot of it is about awareness, firstly. And then secondly, we need to really realize that the more interracial or even intertribe marriages that there are, the more malalignment issues you are going to get.
You're kidding me.
So if we just broke it down simply, what we say is that theoretically, you inherit the size of your jaw from one parent and the size of your teeth from another. So if you are from, and if you think about it, if you're looking at race horses.
You're going to have kids looking at their parents. Daddy, what did you do to me?
So the minute there's a mismatch, then you start to have what we call malocclusions, as in either the jaw is too small for the size of the teeth, Or the other way as well, the teeth are too small for the size of the jaw, which is very prominent in our part of the world. So you get a lot of spacing. So some of these issues now tend to come up and will tend to actually become more and more common.
Okay.
So it means that you are going to see more children with braces. However, there is just so much development that's actually going through. But on average, we want to see the children around the age of 8 to look at alignment issues.
All righty. Okay, 49 minutes past the hour of 2. We are hoping to align with 3. You know what I mean? Yeah? Okay, someone says, my daughter is 10 and still sucking her fingers. Are we safe? Well, first of all, it's her fingers, so that's safe. She's not sucking anybody else's fingers. But at 10, sucking your fingers, docs.
So this is bound to cause problems. Yeah. Depending on how it's positioned in the mouth, and then secondly, the actual duration. So as brace experts, we know that on average, there needs to be over 4 hours of pressure in order for teeth to move. But if this habit, for example, is happening whilst she's sleeping, then you're already getting 7 hours. So the teeth are going to move in a direction which is not where they should be. Wow. So definitely, we need to try and start encouraging the habit to be abandoned, and then look at where we are with the teeth and whether these also now need to be corrected.
Okay, let me look at Dr. Brefo because, well, I can see Novishi doing that as well. But, I mean, some parents, they don't chill you. You are sucking your thumb again. Wham, bam, bam. I mean, physical punishment, violent suppression of habits, shouting and all that. We're dealing with developing children here. How should parents respond to this? I mean, of course, you guys are the professionals, but hey, it's happening here right now, Hacho, Igbe Town, Swami. Should I not check my child and be very, very stern about this?
So, as Dr. Novishi said, I mean, usually you want to give autonomy, and then once you realize that that didn't work, there are other forms that we actually take.
Tell that autonomy in some homes, please.
Okay.
please.
Okay. So we have
a friend of mine will say, respect yourself. But giving a child autonomy, you are sucking your thumb. I've talked to you. I've those knocks and blows and whatever. How do you give a child autonomy in that kind of home?
That shouldn't be part of the discussion at all.
So you're talking to this child.
So then we graduate. We go to something like positive reinforcement.
Okay.
So you actually still have a sit down with the child.
Okay.
Tell the child that's okay. So we're going to pick dates. We're going to do this. Okay. So let's say within the month, if you don't suck your thumb for like say the whole week,
all right,
this is what you're going to get.
Okay.
So positively you're reinforcing the child to stop what they are doing.
They get something good.
They get
something they like for not engaging in the behavior.
Definitely.
All right.
And then it goes on to 2 weeks. Then they get something, and in a month they get something. By so doing, you know that it decreases, it keeps decreasing, it keeps decreasing.
It's scientific bribery, okay? But at least it gets, we're making you feel good for inhibiting the behavior, right? And moving in the desired direction. Okay. Of course, after some time, you need to be able to sustain it in the absence of the reward. We can't be paying you every time, giving you goodies for doing the right thing.
Exactly. And then you also get those who have really tried. So you can tell that during the day, they are really, really trying. But then they are not being successful at this. And this is when habit breakers come in.
Okay.
So we have a lot of tools that we can even glue into the mouth so that they cannot take it out. Yeah, which will mean that they are just not able to actually continue with the habit.
All right.
Yeah, and what we know, for example, is that a lot of the comfort comes from a particular area of the mouth.
Okay.
So we make sure that that area is covered.
Okay.
And so even if they try and do the habit, they don't get that same contentment. And so then you find that once we have tried everything and that's not working in inverted commas, or once the child has demonstrated that they are engaged and they do want to stop, but they require some help, we take over and we fit these appliances that usually stay in for about 6 to 9 months and have over a 98% success rate of breaking the habits.
All right. Lumo in Adidome brings in tooth grinding, gnashing, rubbing teeth against each other at night, especially nocturnal stuff. Bruxism, eh?
Bruxism, definitely.
Right. Okay. Let's explain it for my listeners.
Okay, so bruxism is, as you said, you're just rubbing your teeth together, but you're not chewing on anything. You're just chewing your, rubbing your teeth together.
Is it that it feels good? I mean, is that
it could be due to stress sometimes when
Stress.
people are anxious.
Okay.
And then sometimes...
Novishi said that the CEOs like hair do it a lot. Right. Okay. So stress, tension. And
yes,
this can manifest and be evident in kids as well.
Yes.
Okay.
Yes. But then when this happens, actually what happens is because of the friction that is going on, it wears down the teeth. And once it's wearing down the teeth, it also cause the muscles to be a bit more tensed as well.
Okay.
So in effect, they give you problems. Okay. So how we manage this is as Dr. Novishi said, we have a wide range of things that we give to people to limit or stop some habits. So we have what we call night guards, very soft, clear plastic.
Night guards.
Or mouth guards, yes.
All right.
So
These are not macho men from somewhere. Night guards. You know, I have this habit of slowing you down because we are comfortable, right? But somebody's listening to us.
Yes.
Night guards.
Night guards. So like the
What
mouth
are
guards.
they?
So like you see when sports people, I mean the boxers usually or UFC, they have all these guards that they put on their teeth. So that when they are knocked or something, the teeth don't
They have this
break.
annoying spot slapping.
Yeah, that's it.
Who does that? All right. So you wear something.
Something like this.
Okay.
I mean those who are on Facebook.
To sleep.
On their life.
Abba.
So they're actually really, really comfortable. But also for children, there's a particular age group around about 3 to 5 where a lot of them actually grind.
Okay.
And in that case, provided that they are not damaging their teeth excessively or complaining about sore muscles, etc., we tend to know that this will usually phase itself out.
Okay.
So in children, we tend to monitor, and provided there are no obvious adverse effects, we expect up to 70% of them to abandon the habit without any intervention.
Okay.
But if it's obviously causing issues, then we do have to intervene. And it's really, really simple, and it's actually really, really comfortable.
Right.
So the
Is
actual
this for both
solution,
upper and lower teeth? Or?
we tend to do one arch. So
Okay.
one, either the upper or the lower. And
Right.
it's extremely comfortable and extremely, extremely effective.
Okay, I didn't expect you to say it was uncomfortable anyway. But I believe you. I trust you. I trust you. Big Nortey. Who's this giving me title Big Nortey? What did I do? It says, Big Nortey, please, what about a 60? Okay, I've done that. Please, suck the lips. 6 to 7. We've talked about that. Jijo from Dodua. Hey, I haven't heard from you in a while. We've talked about that, haven't we? Yeah? Sucking of lips and all that. Okay. Sorted. Uh-huh. What is Dede? Dede? Okay. Jaws inherited from dad and teeth from mom. Hey, you don't know Dede in Maryland, eh? Male and female. So what has interracial and or intermarriage got to do with that? Is she implying that if you marry your tribesman, a kid will not have misalignment? Can she explain further? Now, Dede hails from... Okay, I won't say where you come from. Because I'm going to look at your picture again and then see. Yeah, so what the heck are you talking about?
Okay, so just for Dede, if you think about thoroughbred horses,
All right.
who have to have a real genetic lineage
Right.
that is meant to be pure. One of the ways
So,
that
like in dogs, you say pure breed.
exactly
You want certain features to be maintained.
exactly,
Right.
and one of the things that all of the breeders look at and that you used to check the quality, especially before DNA etc. was available,
Okay.
was their teeth.
Right?
And how they are positioned.
Okay.
And so, yes, what we are implying is that if you are a thoroughbred, then you have significant less chance of having dental anomalies to do with alignment
Okay.
and malposition of your teeth.
Right. Okay. Last night, I stayed up watching what's this Will Smith thingy? Emancipation, the slave trade thing, right? But yes, slave trade. They selected the slaves with certain features, and they run in certain families, and so on and so forth. So it makes sense that your jaws and the part from mom and dad. I need to go check pictures and see. But right, it makes sense, and that's why we bring these people into the studio.
But of course, the other side of this is that we are now correcting a lot of things, but you cannot erase genetics.
Okay.
So don't necessarily go and look at mom and dad, or at least find out whether they had braces first.
Right. Okay. So they've had work done.
Exactly.
And you are going to look at them thinking that, oh, okay. Well, that's better than doing a DNA test, Just in case.
That's up to you.
Just in case there's a church member whose jaws look. All right, we're almost out of time. How much does the gluing in the mouth to stop finger sucking cost? Gluing in the mouth to Benjamin is yeah. What's that?
Everything has quite a range. Yeah, so I think that you need to go to a few dentists.
Right.
They need to, first of all, make sure that that's the right thing for you.
Okay.
And then they would cost it out
All
for you.
right. I always say, look, a lot of these health-related things, I drop cost and I use the word investment. Right, you're investing in something, right, and it gives you the right mindset when you're doing these things. Otherwise, you won't go at all. Nortey and these people. By now, these people look at the way they talk. Right, they're expensive. I won't go. Happy birthday to my buddy Nibi Nima Tebochwe bunch from Jijo. Is this the Nima Tebochwe who was our graphic communications? Well, happy birthday to you, and happy birthday to our turbocharged twins, the Tobo brothers. Yes, one is a specialist urologist, the other is a cardiologist. They were both school prefects. They both champions. They are both men of the faith, and today is their 50th birthday. They're celebrating somewhere. I'll see if I can find them. Yeah. So okay, so can we rinse and spit you guys out? Is there anything you want to leave our guests with when it comes to this spectrum, child and adolescent dental issues? Dr. Brefo first.
Okay, so as we started, we said.
Don't worry, that's my way of being nice to you. Spit you out, yeah.
Okay, so number one, would always say that you should bring your child to the dentist before their first birthday or when their teeth comes out, like around 6 months.
Invite a dentist to the birthday party and then he will check everybody and then you have all the parents looking down.
Don't forget to use your dental wipes after they eat.
Right.
Brushing, age-appropriate toothbrushes, toothpaste. And then also when they are teething, you should look out for the signs and symptoms of teething. Okay. And then also, yes, your 2 minutes brushing. And as Dr. Akoto explained, how you position the child, how you brush.
Okay.
Everything.
Yes. Right? If in doubt, find a dentist. Dr. Novishi.
So just like to say that it's always the key messages, which is do visit your dentist twice a year. 2 minutes twice a day, especially focusing on the nighttime brush. And remember to limit the amount of sugar in your diet.
Okie dokie. We've rinsed them, but hey, my WhatsApp people don't want me to spit them out as well. About grinding, I have a girl who chews the pointing finger with the big molars all the time. So she's really stuffing it in there, right? Is there any problem with that? Your index finger, she's chewing that with her molars. Just quickly, yeah.
So, it's still a habit that we would want to break.
Right.
Okay. So, you should see us and then we would.
Hey. All right. We're done. All right. Happy Palm Sunday to you. I'm still in my, what? Hey, my producer is giving me sign language. Okay. He sent me a love letter. Oh, Ziggy says his name is Badio, not Baidu. Oh, I'm so sorry, sir. All right, Ziggy Badio. Right. I always say bedu. Yeah, I'm standing on my chair. I'm begging. Ziggy has a heartthrob. Me, I'll say it. That one I know. Okay, I can now say bedu. You like the bedu now? I will disclose without any tablets. But yeah, that's my producer, Ziggy Badio. Goodness, is that a Ghanaian name? This is intermarriage. Let me check your jaws. But yeah. Okay. I got that. All right. So we're out of here. Still praise, Holy Week. But we will be back. Easter Sunday, we're back as well. I need to start preaching. All right. So this has been great with the guests from Platinum Orthodontics and Advanced Dentistry, Dr. Novishi Akutu and Dr. Daniel Brefo, who are baptized twice now. He's now a full member, right? Okay.
Definitely.
But which one comes first, baptism or circumcision? Now that I've baptized you, the next one. All right, I'm out of here. Stick and stay on Joy 99.7 FM. My name is Nortey by nature.
Clap your